Breathing is something most people never think about until it becomes difficult. For years, she struggled with constant nasal blockage, disturbed sleep, and discomfort she had quietly adapted to. Clinical evaluation revealed multiple structural concerns: a deviated septum affecting airflow, a bulbous nasal tip, and asymmetry within the nasal framework itself. In complex nose reconstruction, every structure is interconnected. Correcting function without compromising appearance requires extreme precision. The goal was not to create a different nose, but to restore harmony, stability, and proper airflow while preserving natural facial character. Using advanced reconstructive rhinoplasty techniques, the surgical team carefully corrected the septum, refined the nasal tip, and rebuilt structural support. Every adjustment was measured in millimeters, because even the smallest structural change can affect both appearance and breathing. As healing progressed, the changes became noticeable in more ways than one. Breathing became easier, sleep improved, and the facial balance she had always wanted finally felt natural. Complex nose reconstruction is not simply about appearance. It is about structure, breathing, sleep, balance, and quality of life. At DEC, every procedure is approached with precision, personalization, and respect for natural anatomy.